Hawaii Music 93.5 FM, Aloha Thursday morning, and we want to thank our ohana from the Maui Memorial Medical Center, Maui Health, calling us this morning. We want to say aloha kakahiaka to Respiratory Therapist from Maui Memorial Medical Center, Loreto Mendoza. Good morning, Loreto.
Hey, how's it, Shane? Big mahalo for having me on here.
Of course. This is your first time, right?
Yep, first time.
Awesome. Sound like you did this before. All right, Loreto, a couple of questions. So, for those who might not know, what exactly does a respiratory therapist do?
Yeah, so as a respiratory therapist, we help patients who are having trouble breathing or have lung conditions. That could mean giving oxygen, using nebulizers, or even helping someone on a ventilator. We monitor patients to make sure their treatment is working just as needed. We also help educate patients and their families on managing their breathings at home. And we work closely with the doctors and nurses to make sure everyone's care is coordinated correct.
Loreto, what kinds of patients do you usually come across and work with?
Yeah, so we mostly work with patients admitted to the hospital, for those in the ER, ICU, and labor and delivery. We care for patients recovering from their surgeries, dealing with serious illness like pneumonia, or managing chronic conditions like asthma and COPD, as we know. We also respond to emergencies where someone's having trouble breathing, give them the support that they need. And to get an idea of the different type of things that we do, you can visit mauihealth.org/respiratory therapy.
Loreto, tell me, how do you fit into the hospital care team? What's some of the things that you're responsible for?
Yeah, in the hospital, we play a huge role in patient care, working as a team. So we support the doctors, nurses, especially during emergencies or when patients need specialized breathing needs. We share updates on patients' progress. We help educate the staff on different equipments that we have, and basically make sure everyone's on the same page so the patient gets the best care possible.
Also, how do you decide, there at the hospital, I can only imagine, you got to really pay attention. How do you decide which treatment is right for each patient?
Yeah, well, every patient is different, so it's always based on what the patient needs in that moment. For instance, if someone has asthma, we would give them like a nebulizer treatment. On the other hand, if someone has low oxygen saturation, we'll give them supplemental oxygen. And if a patient can't breathe enough on their own, we would assist with the doctor in intubating and place them on a ventilator. From there, we would closely monitor their progress and adjust as needed in partnership with the care team.
Loreto, I can only think that, while you giving the treatment, that's one thing, but the emotional support too, because, somebody who cannot breathe is almost in a place of panic.
Oh, yeah, for sure. We kind of have to have some good rapport with every patient, making them feel comfortable. Everybody here is family, so we got to take care of everybody.
Exactly. Well said, buddy. Loreto Mendoza, respiratory therapist, Maui Memorial Medical Center. Hey, buddy, we'll talk again. Thanks for calling this morning.
All right, mahalo, Shane. Have one good one.
Yes, aloha.
Aloha.